Hi, my name is Leah, and I am the physician assistant here at Beth MD Plastic Surgery and Results Med Spa. I am going to talk a little bit about the post-care after having a deep laser resurfacing procedure. The post-care after these deep laser procedures is extremely important to optimize your result, but also to prevent any complications as well. And it's a little involved, so I just want to explain kind of the steps and the products that you would be given in your post-care kit that comes with the procedure. So first step, when you come to the office for your laser procedure, you're going to want to come free of makeup, free of any moisturizers, just barefaced. We will then take some pre-treatment photos, a pre-treatment Visia skin analysis, so that we can compare your before and afters. And then you will be placed in the treatment room, potentially with a little numbing cream on, and we let that numbing cream sit for a little while, and that's going to help with comfort. We have some Pronox available as well, which is laughing gas, and that also can help kind of keep patients comfortable during the procedure. We also use some injectable lidocaine to numb up areas that we're going a little bit deeper as well. So for one of these corrective lasers, you can expect to be in the office for about 2 to 3 hours. And that includes the time for pictures and numbing and get through the treatment. And then some patients want to kind of relax with a cooling mask on after the procedure. So just plan to be here for a few hours. And then usually I recommend after one of these bigger lasers to have someone drive you home as well. Occasionally we will give a little bit of Valium to calm patients' nerves. When they arrive to the office, they will take what's prescribed. And then if the patient is wanting to do that, then they will need someone to drive them home after the procedure. After your laser procedure, you can expect to have some oozing, maybe a little bit of bleeding. That typically, the bleeding stops within about 24 hours or 24 to 48 hours. There is a bit of kind of oozing or serous fluid that you can expect, and you will dab. You can just take clean gauze and kind of dab as needed. After your surgery or after your laser procedure, we will be putting on a cooling mask, and this is sterile. It's made to go on after a laser procedure, and that helps kind of take down the heat and also hydrate up the face, and it has a nice cooling effect as well. So then we will place what ointments that we need to place on, and then you're going to go home you're going to keep the Velez mask on for the drive home, which is also why it's helpful to have someone driving you home. You can keep that Velez mask on for 2 to 3 hours and just get home and get comfortable. After you will be sent home with a second Velez mask, and you can kind of take off the first one and pop the second cooling mask on and just kind of relax with that on for the next 2 to 3 hours. They can be rehydrated in a bowl of clean water if you want to kind of help reuse it, if it doesn't seem like there's too much of the serous fluid or bleeding on it, but you can reuse those one or two times, and then just discard and throw them out. For your post-care regimen, you're going to do this system twice a day, morning and night, and occasionally you will have to add a little bit of extra ointment in the middle of the day. The main key after these deeper laser procedures is to prevent anything from drying out. So we don't want to see dry, thick scabbing. We don't want to see dry crusting on the skin. We want everything very, very hydrated and moist, and typically ointment like a Vaseline or Aquaphor is going to be our best bet for that. So we will have you, you will be given a brand new tube of Vaseline, and you'll use that in your post procedure protocol. So you're going to be given a gentle cleanser, and you're going to wash very gently. Occasionally, if you have a lot of ointment on, you can just take a little gauze and wipe very gently to get the ointment off. But otherwise, then you just go ahead and use the cleanser with cool water. And then after you're finished with cleansing your face, we will give you a tube of Strata Cell or Strata Med, and that you're going to apply on the areas that we did the deep laser resurfacing. You want to have, this is a breathable ointment, so it allows heat to kind of escape. It allows some oozing and some oozing to happen while remaining on the skin. So this is good for the first 2 days. So you will go home with a tube of the Strata Cell. So you're going to place a good layer of that on the skin. And if you need additional moisture or feel like certain areas are drier, then you're going to place a little bit of ointment on. That's what you're going to do for the first 3 days or so after your procedure. Another thing to note is that occasionally it's helpful for patients, and it provides a cooling effect to do what we call white vinegar soak. So you will take a bowl of ice water, a bowl of clean water, and then you're going to place a couple tablespoons of white vinegar, distilled white vinegar. And you want to make sure that you are diluting down the water. You should not just put straight white vinegar on your face. That will not be pleasant. So we're basically diluting down the white vinegar in a bowl of ice water. Usually for a big bowl of ice water, you're going to put 1 or 2 tablespoons of the vinegar. And you will place some gauze, some clean gauze in there, wet, and get the gauze nice and damp. And then you're gonna place the gauze on the face and just sit with that on for about 10 to 15 minutes. That's gonna loosen up any crusting or sloughing. The white vinegar helps decrease bacteria on the skin, and it has a cooling effect, and it's really helps hydrate up the face, and it helps get some of the scabbing and crusting off as well. You're going to do that morning and night for the first week or so. And then after you do your white vinegar soak, you're going to go in with your ointment afterwards, whether that be the Strata Med or the Vaseline. So on about day 5 to 7, we will add in a exosome product. So in your post-care kit will be a product called Plated. This is going to help decrease your downtime. It's going to help with skin regeneration. It has lots of growth factors in it to help collagen stimulation. So it's a great product to put patients on after laser, and it's going to optimize your results a lot. So we have you start that a few days after the laser, after your skin has calmed down a little bit, and you're going to do the Plated twice a day for probably the first month or so after surgery, after your laser procedure. Around day 7 to 10, as the crusting and the skin is healed and there's no more scabbing or crusting on the skin, you can transition to a post-care moisturizer, which is a little less oily during the day, and then just sparingly use any Vaseline at night or in areas that seem to be a little more, a little drier. And that will help, that's gonna help with being able to go out during the day and not feel like you have a face full of Vaseline. So you can transition to a post-care moisturizer around day 10 to 14 or so. And then you can continue with Vaseline at night. In terms of the healing time, you can expect for after one of these big lasers to have about 10 to 14 days of downtime. In the areas that we're doing deeper laser resurfacing, you will have like a pink hue to the skin, but that does fade over the next few weeks after the procedure. You can expect swelling as well. The initial burning, the burning sensation that happens right after the laser subsides considerably at around 2 to 3 hours after the procedure. You're going to want to use lots of sunscreen when you are going outside again after the first couple weeks. You're going to want to use lots of sunscreen. Just be really diligent about avoiding any sun exposure. And you're going to want to wear any hats and sunglasses and that kind of thing. And just be really careful because your skin will be very sensitive to the sun, and sun exposure after this procedure can cause some complications. So we will pick a sunscreen that is right for you. Typically we like a mineral sunscreen and something that doesn't have irritants in it. Patients tend to like our a tinted sunscreen because it can kind of fade out some of that pink hue that you can expect after one of these deeper lasers. And usually by 2 weeks out, you can expect to go back out in public, or maybe wear a little bit of mineral makeup or tinted sunscreen and feel comfortable. The collagen stimulation that happens after the laser, that can take up to 3 to 6 months. So we're not going to see your full result until about 3 to 6 months after the laser procedure. You'll notice your skin is going to be brighter and smoother after those 2 weeks after the laser, but the result continues to get better and better over time. So that is the basic regimen, and occasionally we customize it to the patient and depending on kind of what works best for them and kind of how their healing journey is going after surgery, or after the laser procedure, we can adjust as needed. Typically we are treating prophylactically or preventatively with a little bit of antiviral medication to prevent any cold sores or fever blisters, because that can impact healing afterwards. So you can expect to have a prescription for Valtrex or a similar type antiviral. Otherwise, medications are determined case-by-case basis depending on the patient's age and any risk factors. So that all is discussed during your consultation and during a pre-procedure visit where we kind of can go over this in more detail. As always, just please feel free to contact the office via phone or email anytime after the procedure if you have questions, concerns. We will be seeing you in the office quite frequently in the first couple weeks after any of these deep lasers procedures, just to make sure you're healing as expected and to adjust the regimen if we need to. But in general, just please contact the office if you have any issues or questions. We're happy to help.